Welcome to Electrolysis Unplugged, an after-hours chat beyond the probe with Joanie and Stephanie. We're here to dive deep into the world of electrolysis, education, and all things hair removal.
Whether you're a seasoned professional or just curious about the art of permanent hair removal, we've got the insights, tips, and fun stories to keep you plugged in.
So grab your tools, take a seat, and let's get into it. This is Electrolysis Unplugged, brought to you by the Electrology Education Coalition. This is very exciting. Joanie, I mean, like, here we are sitting 3 years into this, into our little brainchild here, and it's launched. This is it, guys.
Yeah. So in 2020, going.
we were sitting in our living rooms, trying to figure out what the future of electrolysis looked like when we had nothing else to do. And I don't know if you guys know much about me and Joanie. Some of you are new to us, and some of you are, you guys have been here a while. But we had a very similar background coming up in electrology. We were raised by electrologists who loved to teach. We were teachers ourselves. We were passionate about that. And we also saw where there were gaps in the future of electrolysis. And we are that next generation. So I know I don't speak for myself in this one, but we sat there meeting after meeting during COVID, talking about what this would look like. How could we bring the next generation a better foundation for the future? And that's where this started. I kind of beta tested it last year with my own students. When you guys hear me talk about Zappling Hour, it was one of those things I was going to see what a mentorship would look like. So I tested it on you guys. And here we actually there's glitches, but we're here. So that's my side of the story, and I'm sticking to it.
So what I wanted to get into is talking a little bit about what Electrology Education Coalition is and what really our goals are for this new coalition. So the E2C is a membership-based, education-focused company that we just hope to be able to bring to the electrologists that are out in the field, students that are looking to come into the field, and even professionals that work with electrologists or that kind of need to understand what we do. There was really no true space where professional electrologists could go for continuing education that wasn't super readily available. So yes, there are meetings that you can attend, and before 2020, everything was in person. So very rarely was continuing education available over webinars. And we're hoping to not just have the continuing education available, but to have a really big database that we can build over time of continuing education that will fulfill CEU requirements for different types of association certifications. So if you are a certified professional electrologist with the AEA, we're hoping that you can come to E2C to take some of your CEUs that will fulfill the criteria for your CPE certification. We also hope that through the Society for Clinical and Medical Hair Removal, the CCE certification, we can also fulfill some of the requirements for that. So we're hoping to build a database of continuing education for the field of electrology specifically. Part of that, so usually with E2C, we'll talk a lot about the pillars. And so the first pillar is the education, which is what I'm talking about. And that starts actually with our first webinar on Sunday. So we're doing an insurance-focused webinar, but this is something that kind of launches the E2C education pillar. The second pillar is actually what we're doing right now. So that is the community pillar. And what we're hoping to do with that is to bring electrologists and students together in order to have this 1 hour every week where we can answer questions, we can share with the community and with other electrologists so that we can just give people a place where they can actually learn more, especially if you're done with school or you're by yourself in your office. So something to network and collaborate with other professionals. The last pillar, which is something that is probably more of a 5 to 10 year vision or plan that we have for E2C, is the research pillar. And so this kind of goes into my sciencey background, but I really hope to be able to get the field of electrology more global recognition, like it used to have back in the 80s and 90s, actually. But there hasn't really been much in these times, in the modern times, as far as research in the field of electrology. So we're hoping to be able to kind of, get the E2C coalition to bring together professionals that are like-minded with something like that, and to actually branch into research and education for the field. So that's kind of what we envisioned. And so this is where we're starting today, with actually this week starting kind of strong, because we have mentorship hour right now, and we have the seminar or the webinar that is going to be on Sunday.
And then
This
sandwiches at the
webinar
end of
will be
your
available offline. So if you did not join for the live version, you will be able to purchase it and watch it at your leisure. So that's one of the benefits of what we're kind of hoping to bring to electrologists out there. Makes sense? Yeah.
Pretty cool stuff. So one of the things that Joanie and I were talking about when we were in the wrong link, is we wanted to be able to um, kind of let you guys know who we are. Some of you guys are new to us, and you may have seen our faces online or seen us speak at education events or at our own education events. But we both come from um, very beautiful backgrounds in electrology. And so I thought that it would be kind of nice to highlight that. And then in the chat, we also want to hear where you're from. We want to hear what the name of your practice is, how you found out about us, because each one of these moments, it's like it helps bind what this dream was. So I told Joanie, since we're alphabetical order, she gets to go first and talk about her background. And then I will follow up.
Well, so I was actually I was introduced to electrology. My mom, who's actually in the room right now, she's been an electrologist, since the 70s. And so electrolysis is nothing new in my life. I grew up with electrolysis. The reason why I even went to electrolysis school is kind of a funny story, because we're immigrants, and so we came from a different country, and I actually didn't have a green card until I was in college. And so unlike a lot of my friends in high school, I couldn't get a part-time job during the summer because I couldn't work legally with the visa that I had. And so my mom, who doesn't sit very still, asked, she came home one day after work, seeing me on the couch watching TV. And she just looks at me and she says, "There's no way that I'm going to watch you all summer sit there watching TV doing nothing." She goes, "Do you want to go to electrolysis school?" And I said, "Okay." And so that summer, I actually ended up moving to, the school was in Long Beach at the time. So I moved to Long Beach for 2.5 months between my junior and senior year in high school. And that's actually what started my electrolysis education. So I was licensed very young, and that means that I've been doing this for quite a while. So I've been doing this for 20 years. So there's been quite a bit of different ways that this career actually worked out for me. So I did start with a client base, but I've worked with, especially with Apple's and with Dectro International. So I was a technician for Dectro International. And what that meant is that I traveled the world really to demo the machines. I did trade shows. And so I worked, in trade show settings. I worked with distributors all over the world, selling the machines and demoing the machine, teaching groups of electrologists in different countries, different settings. So I've done anything from, 1 or 2 day trainings to now with the school, longer programs here in California. So there's been quite a bit as far as the teaching goes. I've done in a lot of different avenues. With the salon that I have, so I have an active practice that I still work in. So I still see clients today. And with that, we've grown it from a, sole proprietorship, just me seeing my clients, to something that now employs, we're 9 electrologists. And one thing that the business did grow into was that insurance, taking in insurance clients and doing insurance billing, which is actually what led to the seminar on Sunday. So, that's kind of the roundabout. Now, I'm co-owner of California Electrology Academy, and I own OC Electrolysis and Skincare. That's the salon. And you work with Dectro International with the machines and everything. And, we're coming back doing speaking, different types of webinars, seminars for the association. And so that's what kind of brings us back here today. So that was the short version.
There's
Go
no
ahead,
short
Steph.
versions in our lives.
Yeah.
Well, I have a similar story to Joanie. When I have been around electrolysis since before I was born. My mother started as a practitioner in 82. I was born in 85. So it was one of those things that from the very early moments in my life, my mom would keep me at the office. And I was either being babysat by a patient or hanging out underneath her treatment table, playing Barbies like it was a little fort. And I used to joke around and say I learned electrolysis through osmosis, where I just sat underneath the table and soaked in all of her consultations. But I had a passion from a very early age for public speaking, performance, and education. I remember being a sixth grader and I looked at my teacher and I said, I'm going to do what you do one day. I'm going to be a teacher. And I just would not relent. I wanted to be a teacher. When I ended up graduating high school early, decided that I wanted to be an adult faster, because that's the thing we do. And ended up graduating when I was 17. Uh, and in that immediately after, within a week of my graduation, I flew out to Colorado and I went to school for a laser hair removal. Because my mom was like, well, you need to make money while you're in college. So this is what you're going to do. And it made sense because you couldn't really work a lot of restaurants and make money in college. It wasn't feasible. And then everywhere, my mom would hire me to go speak on her behalf at like gender affirming conferences. And I think back to those early days of like the trust that patients had in the process, because when I think to like that 16, 17-year-old person who my mom does not like public speaking, and she's like, go tell them about electrolysis. And I would do it. It was just something I really liked telling people about things that I learned about. Um, After I became laser certified, I started kind of just trying to figure out like how I was going to get busier. I saw my mom was busy with electrolysis and laser, and I wanted to make money, to be honest. 18-year-old Stephanie was like, I want to buy clothes. I want to do fun things. I want to do all that kind of stuff. So I then learned how to do electrolysis by a side chair, apprenticing with my mother, and any and every material I could find when it came to electrology, because I came from an unlicensed state. I just if I could find it, I would read it. And we both lucked out because there was a lot of people that kind of came into our lives in the electrolysis world that they kind of impart knowledge on ourselves, right? And so I would just like a little sponge, just soak that up. And in 2014, when I got the gold probe, we were in Orlando, Florida, and I looked at my mom and I said to her, I am going to open an electrolysis school. And we had just started a nonprofit electrology museum because my background was history and education. And I'm like, and that's what it's going to be. It's going to be a museum, but like that's when it's going to draw people there, and we're going to teach people electrolysis, and we're just going to rebuild this. And kind of found ways to mentor new technicians for our family's practice, because my mother did not enjoy teaching. She would send them my way. I would teach them, and then they would become technicians with us. And last year, well, I would say in 2022, I just had this moment where I was like, it's time. It's time to go fully into education. While I do have a practice, we are distributors as well. We have the school distribution and a clinic. We take insurance clients now. We've joined forces with a medical professional as well so that we can offer insurance-based electrolysis. We just started growing the clinic more, so we now have a new technician with us. And then we launched E2C. So it's like all these businesses kind of came together and they all fold into each other. Um, I definitely feel incredibly grateful to have met a lot of electrologists along the way and had opportunities to speak at these events because it did nurture the educator within my soul, even when I was behind the chair treating people. So that's how I got to the space where we're at now. There is a lot more in there. Like I said, she said before, like Cliff Notes. That's a short version, and I'm sure over the next few months of us really diving into the mentorship, you'll learn more and more about us with the questions that you guys ask. So that's Stephanie Shields.
All right. That's awesome.
Absolutely. I have these questions listed to the side. I was just going to start from some of the ones that we discussed
Yes.
beforehand. So I'm going to have we go back to the fact that we're doing by our names. I'm going to go with you answering quick your first, and then I'll go back to me. We'll switch it up every once in a while. How do you handle a situation where a client is rude, disorderly, or any other type of behavioral issues in your practice?
For me, there's not a lot of leeway with any kind of disrespect from clients. The truth is, I feel like, this is a service, yes, and I do tend to be, give it a little bit more grace sometimes with some rudeness and some shortness from clients. A lot of it will come with the communication and as far as like restating kind of how it goes and how your policies are, what they are in the office, but staying firm. If it's disorderly conduct that is, outside of what I would consider something that's normal. So if somebody is yelling in my face or, yelling profanities or are saying anything that would be kind of belligerent or almost borderline violent, that's a hard no for me. And usually with clients like that, just being very straightforward, but saying that, this type of behavior is not acceptable. And so they will not be, booked from here on out. I have done that a couple of situations, and that might be a little bit more what shows up in your practice. And it tends to be the clients that might make advances or hit on you a little bit. And so that's happened a few times with me and with staff. And sometimes it's been enough for me to say thank you, but no thank you. And then everything goes back to normal. But if it's a situation that makes you feel uncomfortable or unsafe, then I think that it's very much in your, it's very much your prerogative to say that, I don't think I'm the electrologist for you. Sometimes it's best to just, end that where it lays and just kind of don't put yourself in situations that could be potentially dangerous.
Absolutely. I would like to add on to that. I mean, I've had the same thing where we've had individuals that have made inappropriate advances, myself or other technicians that have worked for me. And the fact is I have a full stop mentality. If you everybody knows how they should conduct themselves in public, or in our practices, and if they choose not to, they've chosen not to be in the practice. And so, I'm always, I am assertive, okay?
Mhm.
I'm kind, but at the same time, if they have shown enough disrespect, I just full stop, we are not the establishment for you. We have had, and I'm, very honest about this, we have had to fire clients before to the point where they've left nasty reviews, and false nasty reviews. And there's really not much you can do. And what I will say is the best thing for you is just to elevate the other reviews. Patients, when they're online, they're smart shoppers. If they see 98 great reviews and two like really weird reviews, I would say that they're going to go and go, well, I think that maybe we might have encountered somebody that was not a good person here. But that's one of the big ones. The other thing is when we encounter people that don't follow protocols or are not safe for themselves during treatment. We've had that happen before. I remember walking into a treatment room, finding out that the patient was self-injecting lidocaine, and that's a huge no-no, very unsafe. I said, "Your treatment is done," and I made them leave. There is no there is no smart way to continue that day knowing that they're willing to risk their life and your livelihood and what would weigh on your heart if something were to happen to them. So in those cases, I've escorted them out of the office. It is rare when that happens, but it does happen. For people who make advances, I stop treatment, and you'll end up. I've been in the middle of lasering a set of underarms and been 1/4 in, and the treatment is now done. So you get 3/4 of a hairy body,
Yeah.
and it's just something that I have to do to if you're not going to discontinue the behaviors, I'm going to discontinue the service.
And I think it's important to understand that, sometimes I think that we have to be direct. I
Mm.
think we should always stay respectful. So, don't stoop down to their level. Sometimes you will get a disgruntled person. It's happened to me. A client was, angry about, well, she thought that her chin, which had really, really thick, F4 type hairs, should be done in 3 treatments because she read that somewhere on the internet. And so when it wasn't, she was extremely angry, but to the point where it was unreasonable. And I tend to lock my door during treatments because I'm not at the front desk. And so she came with her husband, and I was in the middle of treatment, and I just hear banging on the door. And it was this lady coming in, and she is just screeching in my face. The truth is I think it's really important in situations like that to stay calm, to stay polite, but to stick to your guns. So if it was a situation like that, I would say that, whether if you are getting hit on or if somebody's acting that, kind of out of the ordinary or in a weird way, you have to be able to say, nicely but directly that, this is not behavior that you can have in your office. And so if it's okay with them, we're going to be ending treatment right now. And I'll give you some time to either put yourself back together to grab your things. I'll meet you up front. And that's going to be it for today. And I've had to do that before and leave no room for negotiations, right? Say the treatment's over today. I'll let you gather your things and I'll meet you up front. And that's where it ends. Everything stays very calm and very, very polite, but it has to be direct.
Mm.
Sometimes I feel like the situations where people get in trouble the most, meaning like the electrologist ends up in bad situations the most, is mostly because they sense the bad behavior, but they don't address it fast enough. And then it kind of goes beyond what you can control. So some situations escalate where most likely your, danger DAR was going off maybe at a level 2, but you maybe ignored that and then let it escalate to a level 6 or 8 by the time that you were like, whoa, this is too much. So definitely, I think being direct and being polite is a skill that most electrologists, especially being in business for yourself, if that's what you're going to do, you have to be able to develop. Not everybody's comfortable with it. And that's part of the issue. Some people you don't like confrontation, you don't like all these things. I don't think most people do. I think most normal people don't want to get in a fight, but at the same time, you have to be okay with standing up for yourself and, doing what you need to do to make sure that these situations are taken care of. You brought an interesting point, which I think could be put on maybe a follow-up mentorship hour, but how to deal with bad reviews or the expectation of bad reviews. Because the truth is that in this type of business, especially, it's pretty normal that you're going to have people go on Yelp, go on Google and leave reviews. And so we can maybe chat about strategies with reviews and, how you bury a bad review and maybe not to also lose sleep over bad reviews, right?
We actually have, I know that you and I have done a very similar talk in the past. We could probably do a bit of a um, breakdown of how we go about doing our own review setup. And essentially, with lack of a better word of saying this, branding ourselves as the professional in our space.
Yeah.
So that's at the top of the next list. I think that would be a really wonderful one because I do think that uh, while reviews are wonderful, reviews also can just drive you a little bit insane, and we want to be able to help balance that out for sure.
Yes.
So, um, how do you handle a client that is very sensitive to treatment or that can let's start with that one. I mean, this is gonna be broken up into 2 questions. So a
Okay.
client that is very sensitive and just cannot handle treatment, what are the ways that you go about that?
I always feel like there's a lot of mental readiness in putting up with pain because the truth is, like I say, like this isn't a massage. So there's
Mhm.
going to be a sensation associated with treatment, and some areas are way more sensitive than others. I think that there's a lot of, as an electrologist, you can develop skills to kind of coach your client through areas or through treatments that tend to be pretty painful. So while I'm not into giving clients PTSD, and I usually will tell them as much, it's like my goal is not to make you leave here and go in your car and cry on the way home. But I want to make sure that we can get through and attain the goals that you're looking for. So we get nowhere if I can only remove 3 hairs per session. And so a client like that might be a candidate for a lidocaine injection if they're really unable to get through anything at all. But 99 times out of 10 or 99 times out of 100, most clients I'm able to kind of coach through to get through a session, even with sensitive areas. So there's a lot of like mental tricks that you can do, right? So, but just talking them through it is a big one. There's also like pain distraction techniques that a lot of professionals have come up with that you can do. And so things like that, I think is kind of how I handle it.
For me, it's about my consultation setup.
Hmm.
Um, I wanna set up realistic expectations. The fact is electrolysis, um, a lot of times people go online and, unfortunately, there has been a trend in the beauty industry to say that they're a painless technician, um, or it's a painless treatment. And patients will come in and they're like and even those home units that are so popular on TikTok right now, and they're like, "It's so painless." And you're sitting there going like, "There's that's because it's not doing anything, right?"
Yeah,
And
right.
so, the fact is we're cauterizing, and changing the chemical structure of a hair, and to do so, and so that hair doesn't grow back, does require a certain level of pain. I do explain to my patients, especially since I have tattoos, a lot of times it kind of helps them understand like certain areas of the body are going to be more uncomfortable. And the tattoo scale of pain is pretty similar to electrolysis. The bigger difference in the two is that tattoos are continuous repetition. So you never stop moving until you switch inks. Where electrolysis, it's a start stop, right?
Yeah.
However, I explain to patients, and I use scientific terminology, that synapse fatigue does occur usually around 15 minutes. And if we can kind of create a nice thinning pattern through the area, their body is incredibly intelligent and will help to reduce overall pain in the area. If they can't make it 15 minutes, then it's going to be a little bit more uncomfortable. And that's when we can utilize vibration tools or throw on their favorite podcast or music that you both can work through. I there's the little vibration tools they use for Juvederm or Botox now. Those are phenomenal. It also sometimes when you give a patient one of those, if they have something to do that's not going to impact you, so like if they have a vibration tool and they put it underneath their chin and it's out of your way, they're distracted because you gave them a task, right? And that helps. Uh, doesn't matter the modality. Sometimes well, not sometimes. I will always hand them a ground. Doesn't mean I'm using it, but I'll hand it
Hmm.
to them because it is something for them to do. It's something to distract yourself from what's going on. Also, um, patients that do experience more discomfort on the table, I express to them that like trauma dumping is actually usually a huge trigger on the table and not smart for them to be able to withstand treatment. Not to mention, we've talked about this in the past. We're not qualified to help them with said trauma. We're qualified to help them remove hair. And so, while I can be 2 ears, I don't. Um, I don't think it's smart for them to use that space to elevate their blood pressure and their mindset and that kind of stuff into a space where it then turns them into a more
You
sensitive patient.
do you want to explain a little bit what you mean by trauma dumping? Just
Oh,
in
trauma
case
dumping.
that's a
Okay. That's a newer terminology the kids are using these days. Okay, we've all had something happen in our lives, okay? And anybody that's on this call, I say something and it reminds you of that bad moment in your life. And so you just take that moment to just um, connect with me and tell me all of the things that happened around that event that I just talked about that reminded you of that event that you went through. And sometimes it then ignites the other person who started the conversation accidentally to do the same, and which is not professional. And I will tell you, as 17-year-old Stephanie, I said stuff on my table that I wish I could go back and just like zip my lip and mute myself. I cannot believe I did that. But also at 17, I just didn't have the same tools that I have at 38, right?
yeah.
But I've seen it happen a lot, especially because people will be like, "Oh, you're like my therapist." And it's the same thing like when you go to your cosmetologist and they're cutting your hair and they're like, "Ooh, tell me all the latest tea and gossip," and that kind of stuff. What they're doing is they are bringing up stuff that is sensitive. The difference is on a cosmetologist chair, they're not doing anything to cause pain.
Yeah.
So, you talk about something irritating that you've been through that probably brought a lot of hardship into your life, and now I'm zapping you with a tiny filament repeatedly
Yeah.
in an area that doesn't feel good. So,
One thing too that can help with pain management is booking your appointments around the right times of day, but also days of the week or weeks of the month.
mhm,
I've always kind of explained to some clients that like pain tolerance, I feel like is like a battery. You know, you have more of it when the battery's full.
mhm.
And as your battery drains, like your patience drains or your energy drains, you have less battery power to be able to withstand the pain. And so sometimes for clients, you do better if you do an electrolysis session first thing in the morning when the battery's full than coming after work because work maybe drained you. You know, there was the stress, it was dealing with other people there, maybe your boss got on your nerves, whatever it is, you know. So you come to the appointment and your nerves already a little bit frayed. The appointment itself is actually going to be more painful in that situation. If you're coming also not in the right state of mind, so maybe you're coming from a time in your life that has some sort of stressful event. It also drains your battery. You have less battery power to put towards dealing with pain. And so these situations can be a big thing. The end of the week, you have the full week that, you know, all of that baggage from the week, and you're taking that into your appointment, and that can also affect how you're able to deal with the pain. So, you know, dealing with pain is mental more than anything else. And so if you just don't have the mental capacity, the mental power to be able to sit there and take it, then for the most part, it's not the right time for that either.
I would even go as far as to say that there are people when we talk about, like, how do you handle a sensitive client, there are people on the flip side where their jobs are so high stress that they come into our office and they fall asleep.
Mhm.
And so, if somebody has, like, their battery is dead, so all they're gonna do is when they lay on the ground or lay on the table, they're just gonna let you go.
Sure.
So I don't want you guys to think that like this by and large is a huge problem, but it's a problem enough to say that, just yesterday I did a consultation and I explained to the woman that the area that we're going to be working, we were working in jawline under the neck, heavy density. We were going to be doing only a 50% clearance in that area. And I'm like, this is your first time. Let's see how you do with the first 15 minutes and then we can extend the appointment from there. Now, as an educator in that space, I book myself lightly so I can go in and out of services to show students different things. I 15 minutes in, she's like, "This is amazing. I cannot wait to do more of it." And she's like, "Do you have more time?" And we were able to extend it.
Mhm.
Um, and to the point where that's I had told her I had put manage expectations that electrolysis in these areas can be more sensitive, and just to expect that if she's had any caffeine prior to treatment. And I went through water consumption, and I went through like, did you eat something? Have you had, lots of sugar, like all those kind of things? And she was like, oh yeah, all of those. I checked all those boxes. I'm like, it might be more uncomfortable. And then she sat there and she's like, this is amazing. And so you're going to come across people that,
Sure.
uh, that is a flip for them. They love electrolysis. They have like heavy satisfaction from that treatment, and good for them.
Today, we want to shine some light on some of our amazing partners who are helping shape the future of electrology education, services, distribution, and so much more. We're thrilled to have such amazing partners and supporters. Whether you're just starting out or a seasoned professional, these vendors and schools have what you need to succeed.
Hey there, electrologists. My name is Hazel Bloom. I'm a life coach for the LGBTQIA+ community and its allies. As a trans woman, I have done the hard work and introspection to figure out who I am, what I want from life, and how to live authentically as myself. These are universal skills that I can teach you and help you gain the confidence to thrive. Also, I know that the conversations with clients on the table can get a bit intense and beyond the scope of electrology, so I'd invite you to refer them to me so they can get the support they need through a tough time instead of taking that burden on yourself. I'm also available as a resource for you if you just need some assistance figuring out how to help a client or to ask any questions. Whatever you need, I can help. My website is kiwifruitcoaching.com, or you can email me directly, hazel@kiwifruitcoaching.com.
Zapmaster Electrology is located in the Pacific Northwest in Centralia, Washington. Stephanie Shields and her Zaplings lead the charge with award-winning education. Whether you're just starting out or looking to deepen your expertise, Zapmaster offers hands-on training, online theory courses, and so much more. And don't forget their distribution center. Led by Michael Shields, this is your one-stop shop for high-quality tools, products in electrology, aesthetics, laser hair removal, and so much more. Ready to enhance your practice? Visit thezapmaster.com. That is thezapmaster.com, and discover the resources awaiting for you. Heading to the Golden State, California Electrology Academy offers an immersive learning experience that prepares students for national certification as well as many states with reciprocity to California's licensing exams. Led by Joanie and Joanne Gonella, they bring decades of quality services and education. CEA offers flexible schedules, open enrollment, and a supportive learning environment, making them a perfect place to start your electrology journey. Be sure to check them out for cutting-edge education right in sunny Southern California. And visit electrologyacademy.com. That's electrologyacademy.com. Thanks for tuning in to Electrolysis Unplugged. Be sure to check out our amazing sponsors for the best in electrology tools, training, technology, and so much more. Now, back to the show.
The second part of the question that came into us was, how do you, and it's interesting that this came as a two-part, so I'm guessing they just didn't put a period in here. For patients that cannot commit to the time needed in the area that they're looking to get done. So let's think about someone that came in for a full beard, okay? And they want to have a full beard cleared as soon as possible. How do you navigate that pill to swallow of, we aren't going to get this done today, we aren't going to get this done next week. So let's build you like realistic expectations. How, if they cannot commit to that time, or they feel that that's too much time to spend at this, what do you say?
A lot of it comes down to the consultation time and managing expectations correctly. I think that it's so important for clients to understand what the electrolysis process actually takes. So I'm a big proponent of explaining the treatment plan very accurately so that they understand what they're undertaking. Because the truth is, I don't really want a client who can't commit. So it's not just, I want their success sometimes more than the client does. So I'm not really interested in clients that are not willing to take their process seriously. Now, there's always situations. So maybe they cannot afford to come in for 2 hours twice a week. Maybe they can't handle it because it's too painful for them. As long as they understand that the process will be stretched out and what that means for their treatment plan overall, I don't mind that. So I don't mind like breadcrumbing the cleanups. So maybe if money is not an issue, but you're not able to commit to 2 hours because 2 hours is too painful, then we can split up those 2 hours and do 2 1-hour appointments. If it's an issue with money, then it's about maybe lowering our expectations as to how much we're able to clear. Because the truth is, I'm not going to be able to get to everything that I need to get to in the time period that was actually booked. And it's not that they're not going to get to their goal, but the goal will be pushed off a little bit later. But either way, permanent results is attainable. But it just means sometimes that you end up doing it on a longer time frame than you would if somebody could aggressively come in the beginning. Not every client will be the perfect star client. Some areas are painful. And so, yes, I would love to be able to do 6 hours, but I can't because you can't handle it. Or their skin is too sensitive. So maybe you can handle it, but your skin can't. We need to let it heal in between. So there's so many variables that go into it. To me, it's important for them to understand the process, to have realistic expectations as to how long it will take. And then any changes in that plan means that while they will still get to the end zone, it might be pushed off a little bit longer.
I like to tell my patients that electrolysis is like saving money. Okay. But it's pennies in a bucket versus $10 at a time. W- Either way, you're going to save money, right? Whether it's 1 penny at a time or it's $10 at a time. But the results to get you there vary greatly depending on how you save, right? And so when I have patients that can't commit to it because of the pain, I just explain that the frequency of our appointments increases so that we can meet the needs of that overall timeline if we are able to. If it is because our body can't handle it, it's simply a thing that we will do everything that we can to get their body to be able to handle it.
Mhm.
But I need them to follow their before and after care. I need them to be able to listen to my suggestions, to follow the recommendations of the professional. And I don't want to say blindly because that's not what this is about, but um, with enthusiasm. Okay. I need you to, if you plan on investing, and like everybody here probably charges between, I would say, $100 an hour to $150 an hour, depending on where they're at. It's kind of the going rate for electrolysis, depending what you're doing. Um, if they're investing, let's say 125 an hour, okay, in getting this permanent hair removal, and they can't commit to following those rules, that investment's gonna take a lot more money to get there because they just didn't do what was recommended of them. Consultations, 15-minute consultation, yeah, those days are done. Especially with us, especially like Joanie and I do the medical side of electrolysis. My medical consultations range between 45 minutes to an hour, depending on how much area we're talking about, how much we're planning for.
And that's what you're going to do on Sunday.
Yep. And we're going to talk. Yeah. So like, I'm not going to be going into that right now, but like, that is one of those things that like, that's going to be much different than my person that comes in for eyebrows. Right. But my person that comes in for eyebrows is like such a great patient because they're a filler patient. When I go in for like these couple hour sessions and then I have like these weird 15-minute or 30-minute gaps because I actually put a buffer in there. So I have these weird 15-minute gaps in the day. That's that eyebrow patient. That's that person that comes in with their like the 5 little stregonona hairs where they're coming out of their chin. That's that person. And that a 15-minute appointment, 2 15-minuters in 1 hour is close enough
Yes,
to your
yeah.
hour. And it's awesome. It gives you relief on your body. So I don't want people to think that just because you can't do massive amounts of hours, that you're less valued on my table, but it's a different way I book you. And how frequently I book would change. And the people that they can't put down their tweezers. And I'm like, okay, well, if you can't put down your tweezers, I'm going to see you 3 times in 1 week. Right. And that stinks for them because in that case, they're spending 3 times as much. But I'd rather them understand that I really need them to put those tweezers down, so that I can achieve permanent hair removal.
Mhm.
And it tends to sink in, that it soaks in, and they're like, "Oh, okay, I gotta do this." On my before and after care, it's pretty detailed. Any of my students will see this. I do like a 5x7 card, and it's both sides, the whole thing, small script and everything. And I tell my patients, I understand that you see a lot here, but I want you to stick to 4 of these items. If you can give me 4 of the 20 items on there, I at least know that you're willing to commit to the plan. What happens is when you tell that to them, they really soak that in. They're like, "All right, I can do more than 4. I know I can." And when they slip up, they're like, "Oh gosh, I went out in the sun. I did, you know, I tweezed a couple hairs," and they feel the guilt, right? But I'm like, "Hey, you've been following really well. Let's just like table what got messed up and get back to your plan." And it
Mhm.
helps them stay committed to the plan, in my opinion. I don't know about you, Joanie, but I am so this was a really amazing moment for 3 years of hard work on our behalf. And we cannot wait to share this with you guys because between the community and the education and the research, it's just it's going to be pretty
Yeah,
cool. Yeah. So
hopefully.
hopefully.
Okay.